Syphilis is a sexually transmitted infection, a condition that can have serious consequences if left unaddressed. It's important to understand what it is, how it spreads, and what steps you can take to protect yourself and others. Syphilis is caused by the bacteria Treponema pallidum, a spiral-shaped microorganism that invades the body through mucous membranes or broken skin. This bacteria is highly contagious and requires direct contact to spread. It's often called the Great Pretender, a moniker that speaks to its deceptive nature, because its symptoms mimic many other diseases, making it a diagnostic challenge for even experienced healthcare professionals. It can present in ways that resemble skin conditions, allergic reactions, or even the flu. This makes it hard to spot without testing, emphasizing the importance of proactive screening, especially if you are sexually active. Relying on visual cues alone can be misleading. The infection typically starts with a painless sore, often referred to as a chancre, marking the point of entry for the bacteria. But if untreated, it advances through stages, each with its own set of potential health risks and complications. These stages manifest with different symptoms, making it even more difficult to self-diagnose. The symptoms can range from mild to severe, and some individuals may not experience any noticeable symptoms at all. Syphilis won't go away on its own. It's a persistent infection that requires intervention. It needs medical treatment, specifically antibiotics prescribed by a healthcare professional. Early treatment is crucial. The longer you wait, the more damage the bacteria can inflict on your body. The sooner you act, the easier it is to cure, preventing long-term health problems and potential disabilities. And the less harm it causes, ensuring a healthier future for you and reducing the risk of transmission to others. In early stages, a simple antibiotic, typically penicillin, can effectively cure it, eradicating the bacteria from your system. But if ignored, syphilis can damage your brain, leading to neurological problems, cognitive decline, and even dementia. It can also damage your heart, causing cardiovascular issues, aneurysms, and heart failure, and other organs including your liver, kidneys, and bones, leading to a wide range of debilitating health conditions. The first sign is usually a firm, round, painless sore appearing at the site where the bacteria entered your body. This sore is called a chancre, a key indicator of primary syphilis. The chancre can appear on the genitals, anus, or mouth, depending on the mode of transmission. Many people miss this sore, either because it's small or because it's located in an area that's not easily visible. Especially if it's hidden or painless, it can easily go unnoticed, allowing the infection to progress without intervention. And it heals on its own, giving a false sense of security. But the infection remains, silently spreading throughout your body. The bacteria quietly multiply, invading your tissues and organs. This leads to more serious symptoms like rashes, which can appear anywhere on your body, including the palms of your hands and the soles of your feet. You might also experience fever, a sign that your body is fighting the infection, and swollen lymph nodes, particularly in the groin, neck, or armpits. You can't rely on symptoms alone. They are often subtle or easily mistaken for other conditions. Testing is the only way to know for sure, providing a definitive diagnosis and allowing for prompt treatment. If you're sexually active, it's crucial to prioritize your sexual health and take proactive steps to protect yourself, especially with new or multiple partners, where the risk of exposure to STIs is higher. Regular STI screening is essential, becoming a routine part of your healthcare regimen. Catching syphilis early means a simple cure, preventing the devastating long-term effects of the disease, and protects both you and your partners, ensuring the health and well-being of everyone involved. Don't wait for symptoms. They may never appear, or they may be too late to prevent serious damage. Take control and get tested, empowering yourself to make informed decisions about your health and protect your future. When it comes to early syphilis, that includes primary, secondary, or even early latent stages, it's crucial to act swiftly and effectively. Early detection and treatment are key to preventing long-term health complications and halting the spread of the infection. The established gold standard treatment, recognized for its efficacy and reliability, is a single intramuscular shot of benzathine penicillin G. This medication has been a cornerstone in the fight against syphilis for decades. This single injection, typically administered into the gluteal muscle to ensure proper absorption and distribution throughout the body, is usually sufficient to completely cure the infection when it's caught and treated during these early stages. The promptness of treatment is a significant factor in its success. Primary syphilis often manifests as a painless sore, also known as a chancre, which can appear at the site of infection. Secondary syphilis can bring about a range of symptoms including rashes on the skin, fever, and fatigue, while early latent syphilis is characterized by the absence of noticeable symptoms, making it particularly insidious as the individual remains infectious without knowing it. Remarkably, the same single-dose treatment protocol is effective and appropriate for addressing all three of these early stages of syphilis. It's essential that this medication is administered by a qualified healthcare professional to guarantee its proper absorption into the bloodstream and ensure its effectiveness in combating the infection. Following the injection, some individuals may experience a temporary reaction, known as the Jarisch-Herxheimer reaction, characterized by symptoms like fever, chills, and body aches, which, paradoxically, is actually a sign that the antibiotic is actively working to eliminate the syphilis bacteria from the body. In the period immediately following treatment, it's crucial to avoid any sexual contact until all sores have completely healed and disappeared, to effectively prevent any further spread of the infection to others. Your healthcare provider will provide specific guidance and advise you on precisely when it's safe for you to resume sexual activity. Diligently following these instructions is paramount, not only for ensuring your own complete recovery and health, but also for actively protecting the health and well-being of the broader community. Thanks to the discovery and widespread availability of penicillin, syphilis is now, fortunately, a readily curable disease when detected and treated in its early stages. If syphilis goes untreated for over a year, it becomes late latent or even tertiary syphilis. Late latent syphilis has no symptoms, but the bacteria are still active. Treatment now requires 3 weekly injections of benzathine penicillin G, 1 shot each week for 3 weeks. This extended course is essential to clear the infection that's been in your body longer. Missing a dose can lead to treatment failure. Tertiary syphilis, which can develop decades later, causes severe organ damage, skin, bones, heart, and more. Penicillin can stop further damage but can't reverse what's already happened. Managing tertiary syphilis often needs a team of specialists. Early detection and treatment prevent these devastating complications. Don't let syphilis reach this stage. Act early. Neurosyphilis occurs when the bacteria invade the brain or spinal cord, causing symptoms from headaches to paralysis. Standard penicillin shots aren't enough. Treatment requires high-dose IV penicillin G for 10-14 days, usually in a hospital. This floods the nervous system with enough antibiotic to kill the bacteria. An alternative is daily intramuscular procaine penicillin plus oral probenecid for 10-14 days, but this also requires strict adherence. Treatment can stop further damage but may not reverse existing neurological problems. Early syphilis treatment is the best way to prevent neurosyphilis. After treatment, careful monitoring, including spinal fluid tests, ensures the infection is gone. Neurosyphilis is serious, but with prompt, aggressive treatment it can be cured. Never skip or shorten your treatment course. Early action is your best defense. What if you discover you're allergic to penicillin after being diagnosed with syphilis? This is a critical concern, especially when considering treatment options and their potential impact. For non-pregnant adults who have more flexibility in their treatment plans, doxycycline is often considered an effective alternative to penicillin. It's a readily available antibiotic, taken orally as pills for a duration of 14-28 days, with the specific length of treatment depending on the stage of the syphilis infection. But the situation becomes significantly more complex for pregnant women diagnosed with syphilis. In these cases, penicillin remains the only proven and recommended treatment option to effectively combat the infection and, crucially, to protect both the health of the mother and the well-being of the developing baby. Doxycycline is generally not considered safe for use during pregnancy due to potential risks to the fetus, so penicillin desensitization is carefully and meticulously done within a controlled hospital setting, under close medical supervision. This process allows for the safe administration of penicillin even in individuals with a known allergy. This carefully managed process ensures the best possible outcome for both the mother and the child, and effectively prevents congenital syphilis from developing in the newborn, a condition which can tragically lead to miscarriage, stillbirth, or a range of severe and potentially life-threatening health problems in the newborn baby. Therefore, all pregnant women should undergo routine screening for syphilis early in their pregnancy as part of standard prenatal care. Furthermore, repeat testing is strongly recommended for those individuals identified as being at higher risk of contracting the infection. Timely and effective treatment of syphilis during pregnancy is absolutely vital for ensuring a healthy outcome for the baby. Penicillin continues to be recognized as the gold standard treatment for syphilis for everyone, regardless of age or gender, but it is especially critical for expectant mothers diagnosed with the infection. Penicillin desensitization is a safe and highly effective procedure when it is deemed medically necessary. Early detection through screening and prompt treatment of syphilis can save lives, protecting 2 lives at once. Consistent and comprehensive prenatal care is your best protection against syphilis and other potential complications during pregnancy. Finishing your antibiotics is just the start. Follow-up care is essential to confirm you're cured. Your doctor will schedule blood tests at 6, 12, and sometimes 24 months to track your recovery. For neurosyphilis, follow-up includes spinal fluid tests. If your antibody levels don't drop as expected, you may need further evaluation or retreatment. Practicing safe sex during this period is crucial. Syphilis doesn't grant immunity, and reinfection is possible. Open communication with partners helps prevent reinfection and protects your community. Skipping follow-up means you can't be sure you're cured. Make these appointments a priority. They're the final step in your recovery. Follow-up care gives you peace of mind and protects your health. Don't leave your treatment unfinished. Complete the journey to full recovery. Prevention is your strongest weapon against syphilis. Abstaining from sex or being in a mutually monogamous relationship with a tested partner is most effective. For others, consistent and correct condom use during every sexual encounter, vaginal, anal, or oral, greatly reduces risk. Remember, sores can appear in areas not covered by condoms, so risk isn't zero. Be alert for symptoms in yourself and your partners, and avoid sex if anything unusual appears. Honest conversations about sexual health and testing are key to prevention. Reducing your number of sexual partners also lowers your risk. These are not moral judgments, just practical steps for protection. Combine these strategies for the best defense. Take charge of your sexual health and stay syphilis-free. Telling your partners about a syphilis diagnosis is tough, but it's essential for their health and public safety. Notifying partners isn't about blame, it's about stopping the spread. Your doctor or health department can help, even notifying partners anonymously if needed. Notify anyone you've had sex with in the relevant time frame. Your doctor will guide you. Partners should get tested, even if they have no symptoms. Sometimes they may be treated before test results to prevent further spread. Partner notification and treatment break the chain of transmission. It's a chain reaction of care that protects everyone. Don't keep it to yourself. Help your partners get the care they need. Testing is the only way to know for sure. Early action prevents long-term harm. Be proactive. Protect your community. Syphilis is serious, but it's both preventable and curable. You control your sexual health. Knowledge and action are your best tools. Don't wait for symptoms. Get tested regularly, especially if you have multiple partners or other risk factors. Open conversations with partners and healthcare providers break down stigma and lead to better care. Regular STI screening should be as routine as any other health check. Early detection means easier treatment and less risk of complications. Every step, using condoms, getting tested, notifying partners, completing treatment, matters. These actions protect you and your community. Taking responsibility is a sign of strength, not shame. Encourage others to do the same. Together, we can stop the spread of syphilis. Stay informed, stay proactive, and stay healthy. The future of sexual health is in your hands.